Okay, Paul, your examination really looks very good, very encouraging. Let's talk about where you are with your diabetes now, okay?
Excellent, yes.
Tell me how the diet and exercise plans that you've been following are going.
Well, I've made it a habit. It's just part of my routine now, and it really keeps me going. I'm pleased with it a lot.
Great, great. That's very good to hear. You've always been good at that, and
Yeah.
I really admire you for sticking with it. I think there's a really good payoff for your health by making it the habit that you have. Now, your medication, according to my records, about 6 months ago, your A1C was 8.9, and then 3 months ago it went up a little bit. And the records that we have say that you've been taking metformin, is that right?
That's correct.
Any problems with it?
Nope.
Good. And the insulin. Now, tell me how you've been taking your insulin, and have there been any issues with that?
Well, the insulin was a bit of a problem after a bit. The injections are difficult, but then we changed the calibration slightly, 80 to 84 or something like that. And I experienced some low blood sugar, hypoglycemia, and that was real uncomfortable, new territory. I didn't like that. So I went back to where we came into it at 80.
Well, first off, sorry that happened to you. People say it's pretty scary when they have a hypoglycemic episode.
Yeah.
Your sugars in the morning are really very good when I look at your map of the sugars you've been recording.
Yes.
And it's clear that when you raise the dose from 80 to 84, that we just pushed things a little too far, and that's why the sugar went too low. So we really can't go any further with that, and you did exactly the right thing to bring the dose back down. So I'm really glad that you did that. The next step that we have to take if we're going to get you to goal is to have to add some more medication. I hope you won't be discouraged by this, because sometimes patients say, well, does that mean I was a bad patient or I didn't do something?
Failed again. Yeah.
No, it's not your failure. Diabetes is a progressive disorder. And so we're actually glad that we have a variety of medications that can meet the challenge of the advancement of diabetes and keep you in control. And we're at that place now where we do need to add another medication.
Okay.
I'd like to share with you a map
Yes.
that's been generated by the American Diabetes Association to talk about what our next best choices are, because I want you to be happy with whatever we do, okay?
Absolutely.
So here we have started with metformin, which you're taking, and you say you're not missing doses.
No, I'm taking everything as prescribed.
Good, and no problems with it,
No.
okay? And then we gave you the basal insulin, which you see is one of the next things on the map. And we've now run into the hypoglycemia with that, which you correctly managed by reducing the dose up, so we don't want to push that up anymore. Well, let's look what our choices are next. One of the things that's on the list here, as you'll see, is that drug called the TZD that we tried last time. Do you remember what the problem was with that?
Was it the swelling?
The swelling,
Yes.
right. And you were very unhappy about that, and I don't want you to be unhappy, okay?
Yes.
So it's not that this wouldn't be a consideration, but as long as this is an obstacle, we have other things to choose from, okay?
Anything with less complications is good stuff.
Good, well that's what
Yeah.
we'll aim for. Now this class of drugs called DPP-4s, they're tablets, and that's a good thing, and they are effective, but they're not considered in the very strong category. Right now, your A1C is far enough from goal that the likelihood of this fixing it is very small. So I don't want to waste your time and money to give you something that has low likelihood of being successful.
Yeah, it certainly seems like I need something stronger.
Well, I agree.
I would rather not step to there. If we have an option of going there, that's what I would prefer.
Good, okay. That leaves us with two other choices at this point. The only other two fairly strong medications are called SGLT2 and GLP. Okay, and I'm going to give you this map so you can take it home, because I know it's hard to remember all these things we're going to talk about today. Both of these are relatively newer classes of medicine. The SGLTs are tablets, and they work by helping your kidney to put the sugar out in the urine. Now that's a really good effect, and it's one of the new things that we've discovered is how to get the kidneys to help us to control diabetes. The major side effects with this is a tablet, are related to the urinary system. In women, there are more yeast infections, rarely more yeast infections in men. And the other side effect of this group of pills, the SGLT2s, is that because they're putting sugar out in the urine, did you ever try that thing where you take a sugar cube when you were a kid, put it above a cup of tea or coffee or something, and see how
Soaks it up.
Soaks it up, right?
Yeah.
Well, if you're putting more sugar out in your urine, then the same thing's going to happen. More fluid's going to come out. So it's associated with urinary frequency. You're going to be urinating more often if you take that.
You know, I'm already on the diuretic for high blood pressure, and the urination thing is already too frequent in my book.
I see.
So if that's a complication of that one, I would be real hesitant.
Okay, well, let's put that on the back burner. Okay, this would be possible, but I certainly respect your business about too much urination. You don't want to worsen that. So let's see if this other group might be more attractive to you as a next step. The next group is called the GLPs. Now, this is an injection, and the way it works is by several different channels in your body. One of the things that would be valuable to you about this class is generally when we start this, we reduce the insulin dose by 20 to 30%. Now, the good news about that is, I remember you saying that the volume of the injection was getting pretty big and was making it more uncomfortable just to inject yourself.
Exactly, becoming real uncomfortable.
Okay, well,
because of the volume.
so I don't want that to happen. We'll reduce the dose of the insulin were we to use this, and that would also save you some money because we'll be using less insulin. The other reason this is valuable is I really admire how you've been following your diet and exercise program. We know that insulin is one of the things that stimulates your appetite and also increases your body weight. So if we reduce the insulin by using this, we'll have less of that appetite stimulation and body weight enhancement type of issue that is associated with insulin. This also improves what's called satiety. When people take this group of drugs, they tell us that their appetite isn't as strong, so they don't have to struggle with food decisions as much as they did before. And it's associated with weight loss. And so I think those things would potentially be very attractive to you.
Would it mean a shot every day?
Well, there are several formats of this. It is an injection, you're right.
Right.
But they vary from a once-a-day shot, a twice-a-day shot, and there are several varieties now that are a once-a-week shot. And they all work fairly similarly. They're all strong, and they all do reduce the appetite and reduce the weight.
The options sound good. I would be uncomfortable with another daily injection, particularly because the insulin because of the larger dose, had become uncomfortable. So if we could limit the number of injections, like you said, maybe a weekly, that would be a much preferred option for me.
Okay.
The injections are pretty uncomfortable.
All right. Then it looks like our choice for you would probably be best to be this GLP. I know you're already familiar with injections, but I'm going to have our nurse show you how to use this particular prescription that I'm going to give you. And what I'd like to do is prescribe this and see you back in a month. Let's see how things are working for you then, okay?
Excellent.
Keep up the good work.
Thank you. Yes.
Well, welcome back, Paul. Good to see you again.
Nice to see you, Doctor. Thanks.
How are things going with your diabetes control and the new medication?
Seems to be much improved on several levels. The glucose values, my appetite is quieting. It all seems to be working.
Oh, that's such good news. I'm really glad. Let's look at your glucose map here. According to the glucose recordings that you have, your fasting glucose has been in the range of 76 to 110. That's really very good. That's right where we want it. And your sugar after meals has also been within the desirable range, basically between 150 to 170. That's all just where we want it. Are there any more of those hypoglycemic episodes?
No, I have not had any of those. The reduce in the insulin has probably helped with that, but it's really good to have those not be in the picture anymore.
That's great.
Yeah.
Now, what about your weekly shot and now your daily shot of the insulin? Have you missed any of those doses, or are you still able to take those pretty reliably?
No, taking everything reliably. The insulin is much more comfortable with the reduced volume. That was important.
Great.
And the weekly shot is certainly much better than having the 2-day shots. I wouldn't have wanted that. So it really seems to have balanced itself out very well.
That's really good. And were you able to find a way to afford the new injection?
Yes. I was able to get a copay card. So that took some of the sting out of that, and the cost is now about $30 a dose.
Oh, that's wonderful. Really wonderful.
Yeah.
Well, the major side effect, remember, that we talked about with the new weekly injection is that some people feel nausea. Was that a problem for you, or is there any such problem going on now?
As predicted, as you mentioned the first time, for the first week there was some nausea, but in the second week it dissipated and everything is really fine right now.
That's great.
Yes.
Well, it sounds like this medicine is a good fit for you and it's doing really well to control your glucose without any more of that hypoglycemia. So that's all really good news. I think you're really doing well. Any other issues you want to touch on today?
Yeah, the only other piece, if you remember, I had three concerns coming in: the glucose, my weight, and the fact that it might be more expense. So we've addressed two of those pretty profoundly, it seems. But the weight thing is still not moving much. My appetite is less, but the weight hasn't shifted much yet.
Okay. Well, I'm glad you told me that many people are expecting that the weight's going to just fall off miraculously in the first few days. What we see generally is a slow reduction in weight over 8 to 12 weeks. And we're just at the beginning now. What many people say is that even though their weight hasn't changed, they see their appetite change, so they're glad about that, so they don't have the same kind of struggle with the avoidance of food. How are you about that?
Yeah, that's much better. I don't seem to be fighting my appetite, so that seems to be in play. It's just the weight right now.
Okay. Well, the good news about your weight is previously your weight had been going up little by little. We don't see any more of that, and that's good. And I anticipate that over the next 8 weeks till I see you next time, you're likely going to lose some weight. So let's be hopeful about that. I think that's what's going to happen. Most important, your glucose is in a much better place, and I think we can be hopeful that next visit you'll likely be at a better A1C state.
That's great, Doctor. Thank you.
Good. I'm glad you're doing such a good job. See you in a couple months.
Yes, sir.
Well, Paul, welcome back. Good to see you again.
Good to see you, Doctor.
It's been 2 months since your last visit, and tell me how things have been going with your diabetes.
Well, I think in general, all of the things that we had hoped for have fallen into line. I still struggle a little bit with the weight, but let me hold on to that one. The urge to eat is way less. I'm much more comfortable with the lower injections of the insulin. And the one-time a week shot has really been sort of the perfect formula.
That is such good news, Paul. I have additional good news for you.
Ah.
When I look over your map of glucose, everything is still exactly where we want it, both for your fasting sugar and your after-meal sugar. So that's wonderful. And do I understand there's been no more episodes of hypoglycemia?
None. No.
Great. Well, remember, our goal measurement is by the test called the A1C, and your A1C is just where we want it, right at 7, which I think is a very good place to be for you. So you've really been successful. My applause to you for doing such a good job. And according to our scale, you've lost 8 pounds since our last visit 2 months ago.
Well, I do feel better, but I'd still been concerned about the weight loss.
Well, any degree of weight loss is good, Paul, because remember, there was a time when your weight was creeping up further and further. And even though 8 pounds might not seem like a lot to you, it may still increase over time, so there may be still more. But even a weight loss of 8 pounds has favorable effects on your metabolism, so that your blood pressure may go down some, your lipids may change in a favorable direction, things like cholesterol, triglycerides. So I think this weight loss is, again, something to celebrate. I'm really glad that you're still able to stay on your plans with your diet and exercise, so you've been able to do that as well.
Oh, yes. Yeah, that's now a habit.
And your baseball hat, are you playing baseball?
Yeah,
Don't you?
getting out there a little bit.
Well,
Absolutely.
I really admire your willingness to stick with the plans, and I think that your adherence to the jobs at hand are making important changes that are going to have long-term payoffs with you. If you're satisfied with this regimen, I think this is the place where we should stay.
Well, I think we should stick to it and see what happens now.
I think that sounds great. So before we go, let's summarize where we've been over the last 3 months, because I'm not going to see you again for another 3 months in reference to your diabetes unless some other issue comes up, okay?
Excellent.
Your type 2 diabetes is a progressive disorder, but you're staying ahead of it by adding in this new medication, and I admire your willingness to step up to the plate and do what was necessary to get your diabetes under control, because you've really been successful doing that, so my applause to you. It's really good that you're still able to stick with the diet and exercise that you've been doing. It's going to be a long-term payoff to you. The glucose problems that you had before with hypoglycemia don't seem to be part of the picture any longer. It's important that we continue to avoid that. So anytime you get to a place where your sugar is getting too low, we need to talk or maybe make an adjustment in your insulin, as we discussed earlier. Remember when you appropriately lowered the insulin last time. So you know what to do about that. We don't want any hypoglycemia. It's too great a risk from that. And I think this once-a-week injection was the right choice for you. I think we've got to a good place I congratulate you and encourage you to keep up the good work. You've done a great job, and look forward to seeing you in a few months again.
Thank you, Doctor, very much.